My name's Anya Abbott, and I am clinical lead on a project which was coordinated by the Royal College of GPs here in Northern Ireland, and it's a project that involved collaboration with a huge number of organisations and individuals who are living with a variety of medical conditions. And the result of the project has been to build this tool, this communication tool, called What I Need You to Know, otherwise known as a healthcare passport. And the purpose of this tool is to facilitate the kind of information gathering that anyone who is living with the day-to-day challenges which are brought on by their medical condition needs, the kind of information gathering challenges that each individual faces. We've learned that anyone who's living with a long-term medical condition faces the challenge of gathering information from a huge range of sources and synthesising that into a kind of coherent, understandable stream of information for themselves and their families or whoever else is involved in their care. And often information from different groups of specialists or different sources can be confusing. So it's useful to have a coordinated tool which acts kind of as a self-management plan, but really when we say self-management, we're talking about whoever are the key people involved in supporting any individual who's living with a medical condition. And this aims to be, if you like, the central gathering point for all the key information that they need to gather along the way. And this evolves over time. It's collaborative. Some of it is completed by the individual themselves or those closest to them. Other bits of information are provided by healthcare professionals or other experts that know a lot about the kind of challenges that the individual faces. And we hope that it will evolve over time for individuals who are using it into a really invaluable resource of information that will help them and those closest to them to keep them safe and well as far as is possible.
Hi, my name is Katie Murphy and I'm a Regional Development Officer with Cystic Fibrosis Ireland. And I suppose with regards to what needs to happen next with the cross-border collaboration for rare diseases is to get the both countries' rare disease guides published and implemented as soon as possible. There needs to be a lot of collaboration between both patient representatives and the political parties that are going to be implementing these policies as quickly as possible. And I suppose the ultimate aim of both plans will be to improve the quality of care and access to treatments for people living with rare diseases, both common rare diseases and ultra-rare diseases. Yeah, it was very positive to hear Minister White from Dublin speaking about the establishment of a rare diseases office in Dublin. I think this would be really a crucial step in ensuring that changes are made and that improvements are enforced for people living with rare diseases across both countries in the UK and in Ireland. And yeah, we were absolutely thrilled that there is a support there from the political background, and having a national office can really shape the future for people living with rare diseases. I think today was a really useful day to hear the different perspectives of speakers coming from the clinical background, patient representatives and political background, and I think it's great, really refreshing to hear that we're all kind of on the same page. And I do definitely think that we're moving in the right direction, and hopefully now it'll be very positive, and by this time next year there'll be some serious progress made, and we'll be all celebrating the publishing of the plans and implementation.
Okay, well, my name is Avril Daly and I work with the charity Fighting Blindness here in Ireland, and I also work with the European Organisation for Rare Diseases, EURORDIS. And my feeling on the next steps for cross-border collaboration is really in first and foremost identifying centres of expertise in each country so that we know where the expertise is and have that coordinated at a central point. From an Irish perspective, I think a national centre for rare diseases, a national office for rare diseases is what we require. And from there out, centres of expertise where people can be referred to in a timely way for appropriate interventions. And then, broader than that, we need to have the establishment of European reference networks. And we need to have those accredited so that the national competences know where to go from a European context, because the reality is with 6,000 to 8,000 rare diseases, we're not going to have the experience and we're not going to have the expertise for every disease in every country. So really the issue is about networking in an appropriate way, in a way that's measurable, that is really based on the USARD guidelines, which is the European Committee of Experts on Rare Diseases, and we need to see that implemented really urgently. I mean, people are still on that diagnostic odyssey. People still don't know where to go. We want to make sure that those people are captured in a system and that they're appropriately supported and get the right information at the right time and the right access. On top of that, another thing that's really very important just to say is the development of registers. Registers are key. Registers that will allow us to understand what the prevalence of conditions are, what the needs are, how people are affected by various different conditions, but also it's important for us to know where the groupings of patients are for the development and advancement of therapies, because if we have cohorts of patients that have been described appropriately, we can attract clinical trials to our various different countries for patients to get access to those trials and ultimately access to the therapies that we hope will emerge from them.
My name's Shane McKee. I'm a consultant in genetic medicine at Belfast City Hospital, and we would deal all the time with patients with rare disorders and often disorders that are very difficult to diagnose. One of my other roles is dealing with the Northern Ireland Electronic Care Record, which is a database project that attempts to bring together multiple different data sources that are in healthcare and present them to the doctors in the clinics and the other healthcare professionals, and indeed to the patients in clinics, as one single view that they can then see all their health records in front of them and get lots of information in one clean view. The idea with this project is to try and avoid the duplication of effort, avoid the duplication of tests, of information, of patients having to tell their stories, to say the same thing to different doctors, different healthcare professionals over and over again. And we're able to then see everything in one shot and be able to understand the patient's key needs at that one time. The key aspect in managing many aspects of rare diseases is information flow. And the biggest difficulty and the barrier that patients face when they're trying to pull their own care together, because we want to give people a degree of control over their own care, is that the information that different people have is maybe not up to date. It's perhaps partial, or it could in fact be completely wrong. So what we're trying to do with both the electronic care record on one hand and with initiatives like the patient passport on the other hand is to try and bring that information, that high quality information, into patient clinical interactions and bring them together. At the moment, these are two separate initiatives, and the hope is that in the longer term we may be able to start to marry that information together so that patient information that is coming from the patient side is being seen more on the clinical side and vice versa. So we're trying to adopt a unified approach involving both the patient and their professional in a shared journey of care of these rare disorders. Because let's face it, I as a geneticist don't have all the answers, the patient doesn't have all the answers, but together we have more of the answer and we can at least formulate a plan towards getting that answer.